Thank you, Mr. Speaker. Mr. Speaker, the CS has told me that the high blood pressure and diabetes medication is in level 3. How will the people in the village know that that medication is in level 3? What are you doing in cooperation with the counties to make sure that the people know where they should be going? Because they go to the dispensaries, they go to level 2, and they are told we don't minister those kind of medications. Can there be a way of reaching out to mwananchi to know where they should go for diabetes and high blood pressure and arthritis, because those are the sicknesses that are down at the ground?
Next is Senator Morango. Do you want to respond? Do you have a supplementary question, or do you want to ask your question?
Asante sana mstahiki Speaker. Ningetaka kumuuliza waziri kama amesikia kilio cha walimu, masikitiko ya walimu na uchungu wa walimu ambao walikatwa zile fedha za SHA, lakini zikaenda kwa hazina kuu ya serikali na haikufikia zile hospitali ambazo wanafaa kwenda kutimbiwa. Na mbando wako na kandarasi na bima zingine ambazo zinafaa pia kuwasaidia katika mambo ya matibabu. Kwa hivyo swali langu ni hilo, kwamba kama ashajua, na kama ashajua zile shida ziko na walimu, amefanya nini kuhakikisha kwamba amesuruhisha ili walimu waweze kupata huduma? Asante sana Mr. Speaker.
Answer those 2-3 questions first. The question by Senator Veronica and Senator Morango, and the clarification sought by Senator Agnes Kavili.
Okay, so I will start.
And then I'll be going to the third question by Senator Aminda Kibwana.
I'll start with the blood pressure question. And so with regards to hypertension and other non-communicable diseases, really communicable and non-communicable diseases in Kenya, we have more than 106 community health providers, health promoters who have been onboarded on the ICHIS platform, and they have been able to register more than 8 million Kenyans out of the 12.5 million households. And they've been able to revisit 7.3 million households, and they've been able to screen 28.2 they've been able to screen patients for diabetes and hypertension in these areas. So we've been able to screen Kenyans, 340 of them who have been referred for diabetes, and 730,000 who have been referred who had hypertension. So the community health promoters are indeed a critical platform that we are utilizing within the community to educate on preventive, promotive healthcare, and then also to identify and refer these cases. Additionally, even for level 2, yes, we have human resource like the nurses there who are able to identify the patients who have hypertension and refer them to higher levels of care. And so we continue with training and capacity building, mentorship and supportive supervision for our CHPs and our healthcare workers to ensure that they are identifying. And indeed, they have been a critical pillar and a game changer in regards to identifying these conditions that were once affecting our people. So again, just to emphasize on the NHIF debt, we are acknowledging the debt is there, and we are again looking at the payment plan. And really, this is the main concern with the private and the faith-based organizations. So what we have requested is that they submit all pending claims for verification, and then payment will follow in suit. So maybe even to give you a background, there was a press release yesterday by the SHA team, and what you can see, there's a lot of effort going towards payment of the social health insurance fund. We've been able to pay 5.1 billion. Then the concern they have is not Social Health Authority. It is indeed NHIF pending bill. For SHA, we've been able to pay most of the time within 30 days, and the ones that were not paid were maybe the claims of which they are reviewing, and quite a good proportion has been paid. We are also having transparency and visibility and really engaging them to ensure that this continues with regards to claims, where they are and how we are progressing forward. So instead of 90 days, we are actually paying within 30 days, and we are pushing for the acceptance of this. But for the NHIF, again, we acknowledge, and we are looking for the resolution process in this regards. Teachers, like any Kenyans, have been able to pay the premiums that are entitled, and so they are able to access the SHA benefits that have been given to them. Again, teachers through the TSC, they use their private medical insurance. This needs to be paid by the TSC. At times they mix SHA and TSC medical insurance. So this is a different scheme which needs to be paid by the TSC. It is not SHA. But with regards to SHA, after registering and after paying their contributions, they are able to access the services under SHA. And maybe also to emphasize, at times, the employers say they have paid, but they have not remitted. And so again, we are brought on board and told that we are not offering SHA services, yet the concern is on the employer side. So we are also emphasizing and negotiating and ensuring that the employers remit. That way we can improve the noise that is out there. Thank you.
Leader of the majority party.
Thank you, Mr. Speaker. Mr. Speaker, I dictated to us a question which has been clarified on those, what are they called, the pending bills, with specific reference to faith-based hospitals. And I wish to urge the Minister to perhaps separate between private facilities and faith-based hospitals, because I know for a fact that some of these private facilities, if you look at the debt burden, it is mostly heavy on the faith-based facilities, for reasons that every Kenyan knows, that it is difficult for any faith-based institution to do some of the things that private facilities are able to do to get their payments faster. And perhaps that matter needs to be treated with more urgency, Mr. Speaker. However, because I've gotten the mic, I want to register my comments alongside that of the chair of the Health Committee, that I am terribly disappointed by the conduct of this ministry, led by the Health Minister, together with her two PSs. They have treated this House with serious contempt, and that is not something that I take lightly as Majority Leader in this House. The fact that they missed our midterm review meeting, Mr. Speaker. The Cabinet Minister says she was in Cabinet. What about her two PSs? Where was Harry? Where was PS Mudhoni? Couldn't they find their way to Naivasha? How can you continue to interact with colleagues whose only interest with health matters is a budget allocation to your ministry? All policy-related matters are implemented at the county governments, Mr. Speaker. You can hear the kind of questions that senators are asking. Some of them is purely on account of the fact that this ministry has failed to interact with this House in the manner that it ought to be, Mr. Speaker. If there is a big failure, Cabinet Secretary, that I want you to register as you leave this House, forget about chief and SHA, much as those are very important issues, is the fact that you have not been able to lead your ministry to have a serious engagement with the Senate of the Republic of Kenya. And for that, I hold no other person responsible other than you, Madam Minister. And that is not something that is acceptable to us. Therefore, Mr. Speaker, I want to agree with your finding that when the minister returns to her office, can she find the time to come and provide an update on all the issues that he had been requested to come and present before a midterm review meeting, and ask for a time that we avail? This House is available on Tuesday mornings and Thursday mornings. Can she pick a day in the next 2 days if she wants to restore normal relations between us and the Ministry of Health, Mr. Speaker? Otherwise, I am terribly disappointed, Madam Minister. And PS Harry knows this, PS Mudhoni, you know this. You are my good friends, but you have let your boss down. You need to work better with a house. We passed those four laws, Mr. Speaker, knowing that SHA was going to be transformational and change the lives of Kenyans. Do not sit in your office, Madam Minister, and listen to your choir of office officials. Come and listen to the representatives of the people to tell you the challenges that people are facing. I rest my case, Mr. Speaker.
Now, Majority Leader, you know, I navigated that matter and I gave guidance. But since you represent the majority side, you have pushed a lot of business from the Ministry of Health. We did actually bills at night, at midnight in Turkana, I remember. So, Madam CS, that every voice coming from the majority leader, you should know things are not okay, yeah? Coming from the majority leader in the Senate. So you really need to organize yourself, reorganize your team, take time to listen to the legislators. You know the Senate is a house of reason. Things that you cannot be able to be told by other people, you can be told by the senators, because we really want, I say it again, devolution to work. Most of the health issues are involved. So most of the time we spend with the senators because we know what is happening in the counties. Don't spend your time chasing for money in the budget of in the National Assembly. After you chase your money, then come back for policies from this house. You can see there is almost more than that the senators are here to listen to you and to dialogue with you. And as I put it, find your time. The time we are located in Naivasha, I repeat again, find your time to sit with the senators. There is a time you came to the National Assembly and you requested us to join you there. We had no time even to ask a question. There was absolutely no time. So what you did at the tent there was not enough. We have many questions. It's only that I'm chairing. Actually, I couldn't have manned you with so many questions if I was sitting on my seat here. So, as I guided senators, let me get 3 more and then we move to the other question. Senator Koiti, Omtata.
Mr. Speaker, sir, thank you for this opportunity to address the Minister of Health.
A supplementary question, not
yes, I'm asking a supplementary question by addressing her. My question is, Cabinet Secretary, conceptually speaking, how do you reconcile the concept universal health care and the practice of paying premiums? Paying premiums means that you have capacity. Universal means nobody is left behind. Paying premium means only those who are able can come on board. So how does it become universal health care when people have to pay premium to access the service? Because we are trying to invent the wheel in Kenya. There's absolutely no country in the world where universal health care is funded through premiums. It is usually funded by main taxes, and Kenya is a signatory to the Abuja Declaration of 2001. When did we move away from Abuja to SHA? That's the question I want you to answer after reconciling the conceptual, the philosophical contradiction that we are visiting upon this country by using stock phrases like universal health care. Thank you.
Senator Chalge.
Thank you, Mr. Speaker, sir, in answering. I think what the majority leader forgot is that the ministry has also left the president to be explaining the issues of SHA instead of them communicating the country even on daily basis. So I hope you take those notes and take it seriously, that as a ministry, you must come out and explain and answer questions so that we don't leave it to the president. So, Madam Minister, we can cut some slack because you just came in, but you must pull up your socks. Finally, Mr. Speaker, sir, there is this story, Madam Minister, can you put it to rest, about baby Ariana Wairimu? Allegations as that she had a bill of 1.6 million, but SHA only paid 23,000. What is the proportion in line of what Senator Wambua was asking in terms of payment in proportion of the bill that the hospital is using? So the case, you can use the case of baby Ariana Wairimu, where that 23,000 only was paid against 1.6 million bill, and confirm to the nation in the same line whether all funds under SHIF fund, critical care fund, and primary health care fund, are those three funds under SHA and SHIF, under Social Health Authority, functional at the moment, Madam Minister, and confirm to the country that whether these three type of funds are functional and Kenyans can access. If they are not functional, just be honest and tell us either one or two are functional. I thank you, Mr. Speaker, sir.
Senator Sifuna, and then honorable senators, we must move to the next question, kindly. Senator Sifuna.
Honorable Speaker, it's not every day I stand up and say that the majority leader has spoken for me. But this is one of those days, and I've always suspected that the majority leader is a good man, because whenever we come to critical junctures where we have to close ranks and say if something is working, it's working, if it's not working, it's not working, he has always done so. And that is the conversation we've been praying for in this country. Honorable Speaker, and Madam CS, you're present here. The president, I heard him yesterday saying he pays 50,000 Kenya shillings for SHA. I very painfully pay an average of 32,000 Kenya shillings every month to SHA. And I say painfully because majority leader, you will recall that when that bill was here, I proposed an amendment to cap that contribution at 5,000. Unfortunately, that time, when a majority leader, you are not as good as you are this morning. You allowed the you voted to defeat that amendment, Honorable Speaker. But I want to cut through the noise, because here in Nairobi, Honorable Speaker, you know they say, hatutaki mambo ya kizungu mingi. Now that the president told us that if we remove that capping, that if all of us pay according to our abilities, we will end the specter of harambes to raise money for healthcare in this country. Can the cabinet secretary standing here before the Senate today confirm to us that there is no family in this country that has planned a harambe for this weekend to get payment for a loved one to obtain healthcare, including that baby Ariana, Honorable Speaker? Can she confirm that to the country? And if she cannot confirm, then she should be gentle enough, she should be kind enough to tell us today that this thing is not working, that we should go back to the wisdom of Sifuna when we were having this conversation in this house. I thank you, Honorable Speaker.
Cabinet Secretary. Very well, Mr. Senator Methu.
Thank you very much, Speaker. In fact, I just want to conceptualize the issue that has been raised by Senator Cherargei and Senator Sifuna. There's no way that the Minister and the Ministry of Health cannot say that they are not aware of the case of baby Ariana, who I would want to confirm, Honorable Speaker, is a patient from my own county, comes from Orjorok in Nyandarua County. Baby Ariana suffered from Pearson disorder, and she is the 10th patient in the world to get that particular disorder. So there's no way the ministry would say that they are not aware of such a patient who has such a rare disorder. And the hospitals in India have actually been using her case as a success of a Pearson's disorder that has been treated. It's a genetic disorder that has been treated. Honorable Speaker, unfortunately, we lost baby Ariana. Her bill, as it were, by the time she passed on, Honorable Speaker, was 1.6 million. What SHA has paid now is 23,000. And therefore, can't we use then this case to gauge whether SHA is working or not working? Because 23,000 out of 1.6 million is such a small and negligible percentage, Honorable Speaker. And you cannot keep leading statistics. This is what we have put as money. This is what the number of patients that have been taken care of. give us on this very specific case that you must be aware of, because it's a very rare disorder. You must be very aware of baby Ariana. Tell us why SHA has paid 23,000. First, confirm whether SHA has paid 23,000, and secondly, tell us why SHA can pay 23,000 out of a bill of 1.6 million.
Very well, Cabinet Secretary.
Thank you very much, Honorable Speaker, honorable members. So I will start with the question from Senator Mutata regarding the UHC premiums. So previously under NHIF, as you remember, it was tax funded, but it was really capturing the formal sector with only 20% of the population under this health insurance. And so when we talk about leaving no one behind, NHIF was not living up to it because we were not able to cover each and every Kenyan when it comes to health service delivery. So when we come to SHA, we see that it is improved, where we are trying to ensure that all Kenyans are on board and all their health